Few viruses are great for you, but some that have caused problems in the past were extremely dangerous. Worse yet, a few of them, like the ones here, are still around. Discussing influenza is extremely complicated, but let's talk about the deadliest one, and according to the CDC, that's the Influenza A virus. There are actually 4 different categories: A, B, C, and D. Out of the 4, A is the only one that's ever caused massive pandemics, and it's also the one that can undergo a fast, drastic change called an antigenic shift. When that happens, it can spread from an animal population to humans, and it's not long after that you'll start to see headlines about things like avian flu. Influenza's chameleon-like ability to shift and change makes it incredibly dangerous. Take the 2009 outbreak of H1N1, sometimes called swine flu. The CDC estimates that during the first year of the outbreak, around 500,000 people died from it. And while typically the most susceptible demographics include the very young, very old, and the immune-compromised, this particular flu targeted people younger than 65, and it's still out there. Between 2009 and 2018, around 75,000 people died from it. That's an entirely different thing from seasonal flu, which goes around every year, usually between December and February. That's what we're prepared for, because most people have been exposed to the virus before or had some kind of immunization. It's when the virus changes that terrible things happen. Everyone's immune system is starting from scratch at that point, and, well, building up a whole new line of defense takes time. According to the World Health Organization, Ebola is pretty rare. When the virus does make the jump to human populations, usually coming from close contact with certain kinds of animals, it can have a fatality rate of anywhere from 25 to 90%, depending on the outbreak. Sadly, one of the groups at the highest risk for being infected are healthcare workers who are treating patients, as the virus can spread through blood or other bodily fluids. Ultimately, though, the CDC says researchers still aren't sure where the virus originates, but they do know that there are at least 6 different versions of it that cause illness in various animals. 4 of those can infect and kill people. Symptoms can take as long as 21 days to appear, though a person isn't contagious until they're symptomatic. And those symptoms can include things like fatigue, muscle pain, headache, fever, and sore throat. Those then escalate quickly into vomiting, diarrhea, and impaired kidney and liver function, often with internal and external bleeding. It's safe to say Ebola is truly a nightmare.
What does it feel like?
It takes so much out of you. It really does. It is very draining.
Part of childhood is being traumatized by the classics, and that's definitely true of Old Yeller, the tale of a boy who's forced to shoot and kill his beloved dog after the pup contracts rabies. Isn't the innocence of childhood a wonderful thing? But there is some good news. The CDC says that rabies is completely and absolutely preventable, and you can definitely keep both yourself and your pet safe. But it's also completely and absolutely fatal if left untreated. The rabies virus is transmitted through direct contact between broken skin, mucous membranes, and infected tissues or saliva. Most often, that's a bite from an animal that's infected. Technically, any mammal can get rabies, but it's most often seen in skunks, foxes, bats, and raccoons. Rabies is also pretty tricky. Early symptoms are similar to symptoms of the flu, and it can take months to progress to the point where the patient suffers from strange things that start with anxiety, confusion, and cerebral dysfunction. That escalates into insomnia, hallucinations, delirium, and a fear of water in an acute period that lasts somewhere between 2 and 10 days. Less than 20 people have been documented to have survived a diagnosis of clinical rabies. So, bottom line, if you've been bitten or scratched by a wild animal, consult a healthcare professional. They'll assess your risk and immediately start treatment if they decide it's the best course of action. Until then,
vaccinate your dogs and cats.
Dengue fever might sound like something that only explorers in the 16th century had to worry about, but according to the CDC, around 40% of the world's population lives in areas where it's still a significant risk. Every year, around 22,000 people die from it. It's caused by a virus that's spread by mosquitoes, and as far as a vaccine goes, there's good news and bad. The good news is that there is a vaccine, but the bad news is that it's only recommended for people between 9 and 45 years old. And if someone is vaccinated then gets dengue anyway, they're at a higher risk of getting severe dengue, which is, of course, the deadly stuff. Once severe dengue develops, death can follow within just a few hours. For most people, it's the fever that's the worst. Then there's the aches and pains, along with the rashes and the very, very specific symptom of major eye pain. Once it turns into severe dengue, though, that's heralded by vomiting, bleeding from the gums and nose, and ultimately shock and death resulting from severe internal bleeding. If you're traveling, plan appropriately.
You should take every step to protect yourself from mosquitoes. Use your repellent and cover up when you have to be outside.
What we now know as HIV/AIDS was first identified in 1981, and according to the U.S. Department of Health and Human Services, it's remained one of the world's deadliest epidemics. Here's how it works. The virus is spread from the fluids of an infected person through the mucous membranes of another, where it enters into the bloodstream. That most commonly happens during intercourse or by sharing needles during drug use, but it can also spread from a mother to a breastfeeding baby by receiving blood transfusions or organ transplants, or from a severe bite of an HIV-positive person. Once the virus is in, it goes right for the immune system. There's no cure, although there are treatments which have been proven to keep people healthy and stop the virus from spreading to others. These treatments have even been found to stop the development of AIDS, as long as they're continuously taken according to instructions. Without treatment, HIV will progress into AIDS, and when that happens, the average expected lifespan is about 3 years. It's typically not the virus that kills a person, but their vulnerability to other diseases, conditions, and cancers. Tragically, it's been estimated that over 70 million people have contracted the disease, and over 30 million have died from it.
It is still a very bad, very unfortunate thing to get HIV infected.
Smallpox is nasty. According to Forbes, it infected around 300 million people just in the 20th century and killed about 100 million. Those that contracted the disease suffered from not just blisters, but blisters so bad they caused blindness and permanent disfigurement in survivors. In 1980, the World Health Organization declared smallpox had been officially eradicated thanks to the success of a global vaccination program. But here's the thing. Scientists are now worried that thanks to global warming and the melting of ice that's been frozen for a long time, smallpox might just be waiting to make a comeback. And yes, there is a precedent for it. Melting ice in Siberia released anthrax, which hospitalized 24 people. Scientists are still researching smallpox, which is caused by the variola virus, and it's not just because of the possibility that global warming is going to unleash another pandemic. There's also the possibility that it could be weaponized. A few vials of it still exist, and it's possible there are more out there than we know. In 2014, the National Institutes for Health announced they'd found a few vials in a storeroom.
Vials of smallpox had been forgotten for decades and were just discovered in a cardboard box.
So while it might be officially eradicated, it's not entirely gone yet. On December 31st, the year 2019 made it clear it wasn't going out without one last parting shot. That's when the World Health Organization was informed of a coronavirus outbreak in Wuhan, China, one that was eventually named COVID-19. The name change came because this isn't the first time the world has seen a coronavirus outbreak, not by a long shot. According to the CDC, the SARS outbreak that spread to more than 24 countries in 2003 was also caused by a coronavirus. In that outbreak, 8,098 people were infected and 774 died from a severe respiratory illness that often turned into pneumonia. Like COVID-19, SARS was spread most easily through respiratory droplets expelled by coughing and sneezing. Then in 2012, there was another coronavirus outbreak. This one was called MERS, and it was centered around Saudi Arabia. This version of the virus was particularly dangerous for those with pre-existing heart, kidney, or lung conditions, or those with already compromised immune systems. The fatality rate was around 30 to 40%. And that shows just how many different strains of coronavirus there are. Scientific American says 4 strains in particular cause about a fifth of all common colds, and the virus family's recent propensity to mutate has researchers scrambling. In 2019, the World Health Organization reported that once again there'd been an increase in the number of measles cases. Why? Well, as they put it, quote, "The disease has spread fast among clusters of unvaccinated people. That's resulted in the deaths of young children." In 2016, the WHO declared the UK to be measles-free. In 2019, though, the BBC reported that the designation had been taken away, as there was a steep increase in cases because of people who had passed on the vaccination. Why? Gee, only if we knew.
Hey, remember that time you got polio? No, you don't, because your parents got you vaccinated.
In 2018, measles killed more than 140,000 people, and in 2017, around 110,000 died. Most were children under 5 years old. In addition to its potential deadliness, measles can come with all kinds of other nastiness, including blindness, swelling of the brain, severe diarrhea, and pneumonia, all of which are serious complications, especially for the very young. According to the CDC, the U.S. started keeping track of measles cases in 1912. In the first 10 years, there was an average of 6,000 deaths each year. The CDC also reports that even though the U.S. was declared measles-free in 2000, that's not the whole story. It doesn't mean there are no cases of measles. Instead, it means that the only cases were ones brought in by travelers. That means it still exists, so there's a good reason to get those vaccinations.
The CDC says it's the best way to stop measles from gaining a foothold again in the U.S.
Yellow fever has its name because jaundice, a condition that turns your eyes and skin yellow, is one of the symptoms. According to the World Health Organization, there are 47 countries in Africa, Central America, and South America where yellow fever is epidemic. In 2013 alone, the organization logged as many as 170,000 severe cases and 60,000 deaths. It's caused by a virus that's transmitted to humans through mosquitoes, and since there are a few different types of mosquitoes living in different environments, there are different types of yellow fever. The symptoms are mostly the same though, and include fever, muscle pain and headache, chills, nausea, and specifically backache. Many people get better in just a few days, but if the case turns severe, it escalates into failing kidney function, as well as bleeding from the eyes, nose, mouth, and stomach. And here's where one of two things can happen. People could recover in around 2 weeks, or they could die. There's sort of good news. There is a vaccine that's available and incredibly effective, but the WHO says we'll probably never get rid of the disease completely. Doing that would mean getting rid of mosquitoes and their natural habitats. We'd also have to eliminate yellow fever in the animals mosquitoes pick it up from. In the meantime, cutting out the middleman doesn't sound like such a bad idea. Mosquitoes suck anyway. Check out one of our newest videos right here. Plus, even more grunge videos about interesting and newsworthy topics are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.